Good morning. It's great to have the opportunity to share with you our experience with the use of fluorescence for sonodynamic therapy, and I would like to thank the Focus Ultrasound Foundation for their support. So, as showed by our colleagues, we know that 5LA can be used in combination with focus ultrasound to treat brain tumors, at least in animals models. And one of the features that is very interesting about drugs such as 5LA is that they selectively accumulate in the tumor. So ideally, when we treat the organ, we will spare the healthy brain. The same biological effect can be exploited using other substances, such as fluorescein, which recently has become an image guidance tool. As you can see in the upper picture, it selectively accumulates in gliomatous tissues. And its mechanism of action is similar to that of gadolinium. So it's an intravascular contrast agent, and it extravasates where there is a damage of the barrier, and it selectively accumulates in the tumor. The protocol when using a fluorescence for guidance, usually the drug is administered 2 hours before the surgery, so it washes out from the organ and it remains in the tumor. The idea of using activating fluorescence for cancer treatment is not new, as it has been started in 1931, as you can see in this paper. Recently, there has been in vitro studies that shows that fluorescence, when under ultrasonic irradiation, is able to create free radicals and ideally induce cell damage. So we decided to use this substance to treat a C6 glioma model. The tumor was implanted subcutaneously in the flank of the animal. We used as a dosage the normal standard dosage used for image guidance, surgical image guidance. We injected the drug IP. With the fluorescence, we showed that the drug selectively accumulates in the tumor, and after 20 minutes it washes out. There is a reduction of the amount of drugs in the surrounding tissue. These are the sonication parameters. We used a single element transducer, low frequency, 350 kilohertz, with a focal distance of 20 millimeters. And the tumor was targeted using a crosshair. We derived our parameters from previous study from my colleague Dr. Shu from University of Virginia, who did studies with 5LA. So the pressure delivered was around 2-3 watts per square centimeter, and we decided also to treat the animals with higher pressures, always in the non-thermal range. We had 5 animals per group. We had a control group with a fluorescent only and negative control. Then a group using focus ultrasound in combination with fluorescent at different with focus ultrasound at different pressures, and focus ultrasound at different pressures only. These are the results. We calculated the tumor fold increase. So of course there is no control of tumor growth with in the control group, not even with fluorescent. We have a slight control of tumor growth with the 3 different focus ultrasound parameters. And interestingly, we had good control of the tumor growth with a statistically significant using fluorescein in combination with focused ultrasound. Particularly with the highest power, we achieved a sort of regression of the tumor. These are the histology results. These are really preliminary. We don't have the whole data set, but this is just to show you that in the control group, we don't have, of course, any biological effect. Whereas the more we increase the power of the ultrasound in combination with fluorescent, the more we achieve the areas of necrosis and islet of apoptosis. So in conclusion, our results demonstrate that there is a trend that indicates that sonodynamic therapy with fluorescein can improve the tumor growth control, and keeping the power in the non-thermal range, the higher the power, the better the control of tumor growth. And of course, some more work need to be done to optimize the parameters in terms of time of sonication, amount of drugs, and focused ultrasound parameters. Thank you for your attention.